Well, at present, the authoritarian lawmakers and leaders in America, all over America, are criminalizing immigrants, women's rights to make healthcare decisions, sexuality, gender expression, blackness, homelessness, and even religious diversity and freedoms. They are trying to erase the teaching of vital history in our schools by Don't Say Gay and book bans and a lot more. The USA has never seen, I don't think at any point in my memory of history, such a significant abuse of power against virtually every group of people at the same time. Some elements of society do not seem to wish to have any diversity or freedom or inclusion at any cost. Today's guest is very unique to address these issues, a well-known face when it comes to fighting discrimination and facilitating state and federal social justice initiatives and lobbying on behalf of an equitable society. Ebonni Chrispin is the Director of Legislative Affairs and Community Engagement at AHF. For all of our viewers, welcome to Unapologetically Queer. I'm your host, Al Ferguson, and I am proud to talk to some of the most interesting people of our LGBTQ+ and ally community that are the most interesting to the LGBTQ+ community. This program is unique because it is an unedited conversation. At Hotspots Magazine Happening Out Television Network, our mission is based on the 10 pillars of the LGBTQ+ community. We believe our history and then our future are based on these communities of Black LGBTQ+, Latino, lesbian and queer women, trans, students and youth, seniors, HIV/AIDS healthcare, business, social justice, and faith. Well, like the movie Network, I loved that movie in the 1970s where everyone threw their televisions out their high-rise windows yelling, "I'm mad as hell and we won't take it anymore." Well, there seems to be a growing discontent in America today over our authoritarian lawmakers dictating what we are allowed to read, do, be, and even say. Hence, it is refreshing and assuring to see the We the People National March that is going to occur on July 2nd. One of the principal architects is with us today, Ebonni Chrispin. Well, welcome, Ebonni, and I have to get right out of the gate. I understand you are an unapologetically queer ally.
I am.
You are unapologetically queer for our community.
Yeah, I feel, as a cisgender straight woman, it's been shocking, to say the least, that there aren't more people with the level of privilege that I do have that don't take the stand that they should make when it comes to people that don't have the opportunities that many people do. As a Black woman, we can have a different discussion, but I think as a cisgender woman who checks off quite a bit of boxes, that capitalism would suggest make you better. You follow a Christian path, you get married, then you have children, you go to college and get a good job, and you don't argue too much, don't speak out too much. And so from my perspective, it is incumbent upon people with privilege, whatever that may look like, to say more about the opportunities that other people don't have.
Yeah, excellent opportunity today to kind of check off all of those boxes. But before we do, before we talk about this interesting march on July 2nd, let's talk about AHF. Mm-hmm. A lot of people know AHF, but perhaps a lot of people don't really understand the details of the AIDS Healthcare Foundation. Mm-hmm. It is a global nonprofit organization that offers cutting-edge medicine and advocacy to over 1.7 million people around the world in 45 countries. It is also the largest provider of HIV/AIDS medical care in the entire world. Ebonni, first, help us understand what exactly HIV does, its principal mission of what you do.
So I think for us, AIDS Healthcare Foundation is following two paths. One, providing healthcare, as you pointed out, and medicine regardless of someone's ability to pay. Ryan White, starting in the 90s, allows the kind of programming, one example in Ryan White, allows the kind of programming and financing that gives people the opportunity and the needs that someone living with HIV and AIDS will have. And that includes going to a healthcare center like ours, taking the medication needed in order to have beautiful, long, fulfilling lives. And so AHF being one of the largest organization that does so, as you pointed out, our goal is to be able to be a public health institution that lives as an example for what government agencies, NGOs, other nonprofit organizations must do in order to have successful, safe, flourishing neighborhoods, communities. And from our perspective, we want to make sure that people know that they have an advocacy organization in us. And I think that's the second path that's important to note, that whether it's civil rights through the lens of Black lives and that of those within the African diaspora, and or someone that is in the immigrant community, and or someone who is in the LGBTQIA community, wherever it intersects, organizations like ours, and specifically to AIDS Healthcare Foundation, are advocating on behalf of often people that aren't voiceless, but are often unheard, ignored. And so that's part of the reason why the March was established, is because we need to be a public health organization that says we are in a health crisis. These different variables intersect: housing, healthcare, food disparities, et cetera. They affect how our clients get into care, stay in care. And so what we're trying to do and work hard to do, and it's successfully done over the 30 years that AHF has been around, is really push and fight back when systems look to continue to oppress, roll back the establishment of equitable laws, or at least the attempt at it, so that our clients and people that aren't clients, frankly, don't have the ability to get married, to have a say on their own bodily autonomy. The issues surrounding housing inequities, the list goes on.
I learned something about AHF that caught me by surprise in December. In the last days of Dr. Fauci, Anthony Fauci, serving as the director of NIH, I was pleased to be able to do basically the only LGBT television interview with him as he exited. And he talked about the process of AIDS, HIV in America. He talked about his friend Larry Kramer, and he talked about how ACT UP was a counterbalance to NIH and government response. But he spoke a lot about NGOs and nonprofits. And the conversation about AHF, for example, was interesting to me because while AHF is a global organization, really its efforts are in regional and local implementation. And Dr. Fauci said that the most important response to AIDS and the most important response of getting us to the zero new transmission goal of 2030 is organizations like AHF, but on the regional and local basis. Do you agree with that? That it's local implementation that really makes the difference in fighting AIDS, HIV, and the needs in our community, that it's local?
I think in large part, as a community outreach advocate, I think part of what we have seen proven is that when you are, you have your ear to the ground in, let's say, a rural part of Mississippi, for example, what we have discovered, which I don't think is necessarily a surprise to anyone, is some of the needs, not all of them, there are common denominators for sure, but some of the needs that a person in rural Mississippi may be very different than the urban core that is Miami, Florida, as an example. And so having regional directors in those areas, having grassroots organizers, having small or nonprofit organizations, 1 to 2, 3 person orgs that are doing the work to connect the dots between the person who has a high risk of testing positive for HIV or is living with HIV. Our goal is to be able to, in some ways, handhold them and make sure that they have all of the access to care that they need in order to get and stay in care. What we have found is that you can't do that always by having a global reach. There's work on the global side, of course, and I don't want to minimize that. However, to your point, having regional offices, small healthcare centers across the country in many organizations, in many ASOs like AHF. What's important for us is that we are having non-traditional partners in these areas, that we are working with local municipalities, that we are sitting on councils and in the street, so to speak, really talking to people about what's going on in their experience, that really may have nothing, that we think has nothing to do with HIV and AIDS, but is a variable that helps unfortunately, the uptick of new cases of HIV in areas like I've mentioned.
And this is a unique opportunity for our community that are touched by AHF in so many different ways. They may know or they may not know. In terms of your voice, gives them an opportunity to hear from you. In the legislative field and community implementation field, help us understand what you do for AHF.
So on the legislative side, I am paying attention to what is happening in a state capital that may have a negative effect or a positive effect on our clients. HIV modernization bills, for example, clean needle exchange that was largely driven a couple of years ago by the University of Miami, but with the support from organizations like AHF. We are able to continue to keep HIV in the conversation around HIV at the forefront of all of our minds. And so part of what I do is understand what the bills mean for our clients and put that in layman's terms so that people understand how laws will affect their everyday experience. And that, in short, is what my role is to be able to take a policy that most people wouldn't even be paying attention to and make it sexy. To be honest.
And we'll get to the reason that's important in terms of following the legislation and what's going on in the politics in Florida and really all over the country. One other thing that I think was interesting is HIV and AIDS is not an LGBT thing. It affects everyone. But as we know, through history, it has disproportionately affected, in the early days, certainly gay men, but it's moved long and far beyond that. One of the things that I didn't know until recently that caught me by surprise is that the founder and CEO of AHF, Michael Weinstein, is gay and comes from our community. How has that affected AHF in terms of its mission and its thinking? How does the original founding of AHF addressing HIV and AIDS from its original days and still having leadership as your CEO from a gay man? Does it have effect on HIV, or is it just it's LGBT gay is not really an issue at AHF?
That's a good question that I don't know that I have a simple answer for. I think to a certain extent it must, right? I mean, I think we're lying to ourselves sometimes when we conveniently ignore lived experience, right? We've all been on social media and have someone comment on whatever may be in the news that's, horrible to hear, right? A trans Black woman gets murdered, and there's someone in the comments who isn't trans or isn't Black and has all of these opinions about how a person is living their life. Those same people that have this lived experience should be, to a certain extent, at the table in the community, a part of legislation, frankly, to drill home the last question, because they have a lived experience and can tell the story better than anyone. I think Michael Weinstein has a unique experience because he was a part of it in the early days. In my opinion, he has an altruistic spirit. His energy is coming from both his lived experience and having 30 plus years of running a nonprofit organization that is doing the kind of work that makes a difference. And I know that seems corny, right? Like people can't really take that kind of goodness we sort of get skeptical quickly. You know, I'm one of those people, right? Like, I don't know about this.
You look at it a little side.
All right, yeah. But as someone in the organization that pushes back often on these notions, even with internally, and Michael will tell you directly, certainly from me, it's been incredible to watch someone who I'm skeptical of white men. I don't know how to say anything differently than that. I am. I just feel icky sometimes.
That's your experience.
That's been my experience, right? And to have worked with him and for him for many years now, it's been cool to watch someone who's had a lived experience.
I love that.
And he's truly philanthropic. I mean, I don't know. I'm one of the most skeptical people in the world, even though I'm idealistic too, which I know is weird.
Yeah.
He's incredible to work for in a lot of ways.
Here's another interesting thing that I learned about AHF. We have just finished, to all of our viewers, I'm sure many of you, we had a gigantic watch in Apple Television of the recent Stonewall Pride Parade. And I was on the main stage and I interviewed somebody about the upcoming march. We're going to talk about it in a couple of minutes. Mm-hmm. But one of the things that I learned that brought me the soundbite in the conversation in the section or the segment that we did on AHF was $96 cents on every dollar is going back to the community. That is an astounding number. And the reason why that was so interesting to me is she made it very clear in our conversation that we should all be intentioned on where we were spending our money in our healthcare, and that the pharmacy mission for AHF as a nonprofit, no disrespect to a Walgreens or CVS, they do a fantastic job, but when you're working with AHF and pharmacy, etc., 96 cents of every dollar that is spent, however it is spent, is coming back to community. Tell me a little bit about that. First off, that's accurate.
It is.
Yeah. And tell me a little bit about that, of how the use of AHF pharmacies, et cetera, how that is beneficial for LGBTQ community and really all of our communities as a nonprofit. You operating the pharmacies and the healthcare as a nonprofit. Tell me about that.
Yeah, that is accurate. And I think my experience has been that the money and the funding that we receive through our, not only our pharmacies directly, but also how just to watch people in community receive, get their medicine, because our drivers take someone's medicines directly to them because they don't have the capacity to pick up their medication. That ability in and of itself, one, from a public health perspective, keeps people in care in a way that not all systems allow for. And what I mean by that is something as simple as transportation, having people that work for AHF bring someone their medication is one way that we help to end the epidemic. And it seems sort of trivial, but as someone that's been in the community for almost 20 years, I can tell you firsthand, the people that are often most affected by some of the public health crisis that we experience as a country, in this country and others, frankly, is sometimes these what seems like menial issues that maybe, I can't speak for yourself, but for me, I take for granted because I can get in a car and go to sleep.
Right,
right,
exactly. Yeah.
And so I just give that as an example because I think that's an important one. But I'll also say, while the LGBTQ community is obviously historically a huge part and will continue to be a part of how we move as an organization, but I think there are a lot of communities that are often not talked about because of stigma, which I'm sure most people are well aware of that, think about these topics. But from our perspective, we work with and partner and sometimes fund programs that are led by trans-led organizations, that are led by Black women organizations, that are Hispanic-led organizations and focus, where we are in communities with 55 plus folks. And I think what I try to do, and I know other people in the community that mobilize around these topics, is really consider what it looks like to not create silos in the community. How do we bridge the gap between these different groups so that people don't feel left out? And as someone who has personally been, unfortunately, negatively affected by the medical community in other ways, while I am HIV negative, I do know what it's like to feel like I'm not being heard. Yeah. And through the lens
Maybe even seen.
Or seen, And that's literally and figuratively, frankly. That is frightening. It feels abandoning. This is my life we're talking about, and I'm being treated like a number. Community engagement means bringing people together, ironically. And I think it's important for us to underscore that. My biggest goal with the work that we do for AIDS Healthcare Foundation is to make sure that people, as corny as it sounds, feel loved. And sometimes the world, an organization wrapping its arms around you means not waiting 3 months to be seen. It means not paying out the wazoo for medication that's going to keep you alive.
Yeah.
These are important parts of community engagement that I think are the foundation to
especially in LGBT, the members of our community that feel the most marginalized.
That's right.
That's really important.
That's exactly.
I want to talk about a program that's near and dear here in South Florida. I can't not talk to you and AHF without talking about the Florida AIDS Walk. The Florida AIDS Walk is a program that is done in March, and it is really, and I have said this in Queer News Tonight repeatedly, it is a genius platform. And the reason it is a genius platform is it encourages people to self-sustain on their own benefit, their own work, to raise money and visibility for their organizational structures. And then when they do, as a recipient of the Florida AIDS Walk, AHF matches everything that they do. So it's like a 1-2 punch for success. And we're talking about Afro Pride, and we're talking about social justice organizations like Equality Florida and SAVE. We're talking about women's organizations like Aqua, and it goes on and on and on. Tell me a little bit about AHF's commitment and why they would want to do a program like Florida AIDS Walk.
I think, so we match up to $500,000. And so one, maybe two organizations, definitely two, reach the $1 million mark. This just past March when we typically have our Florida AIDS Walk here in South Florida. And I think our commitment is because I think there's a lot of reasons. One, again, my cynicism sort of creeping in is, well, what was the reason why we were doing this? This is a lot of money to be giving to organizations. And I think when AHF came in, this is well known, people were sort of skeptical at best of this behemoth of an organization coming in and making their stake in the Florida region, in particular the Southern Bureau, which is what we refer to AHF South as. One of our focus points was, how do we build relationships with nonprofit organizations in a way that tells them that we're trying to be a good partner. And for us, it was knowing that a lot of these organizations, most nonprofit organizations, 90% of an executive director's focus has to be funding, fortunately or unfortunately. And so because we know that we have the ability to be good partners in many different ways, and we have been, Florida AIDS Walk continues because for those reasons, to make sure that we're being a good partner to organizations that have been around a long time. But I think the focus continues to be that we can't be everywhere. We can't do everything. That's not any one organization's job. But when you have organizations like SunServe that largely focuses on mental health, for example, or a Transclusive group that's focused on the transgender community, or Afro Pride, as you mentioned, that's focused on mental health, specifically in the Black community with LGBTQ folks, that work is, I can't underscore enough what beautiful work these organizations are doing. It's, and for us to be able to do so, we can take a step back and say, hey, let's get together. Let's really celebrate in a lot of ways, but also commemorate the people who have lost their lives and continuing to fight for equality and equity around healthcare, specifically around AIDS and HIV, but also different things that are going on in the community that help to perpetuate the continued risk of testing positive for HIV. So I think it's important because, one, we have to be good partners. And two, I think it's important, and to me most paramount, I know that's the same for people within the organization, is we want to make sure that all of these organizations are being supported because of the work that they do respectively.
And AHF, through the Florida AIDS Walk, through the years, has raised millions and millions of dollars for these organizations that in many instances becomes a lifeline for them. We went through We've done 100 stories in the last 3 years at Core News Tonight about the survivability of our nonprofits over COVID-19. So AHF steps in. Remind me, because I don't remember the number. 2023, the Florida Age Walk. What was the total in terms of?
Just over $2.1 million.
$2.1 million. It's just breathtaking. And again, I say the genius behind it is it asks the organizations and those that support the organizations to invest in themselves by making the work happen to raise the first primary money that is then matched by AHF. It's an amazing program. I want to talk a moment about Big Pharma. You've mentioned it. We talk about finance and money, and there's money in drugs and development, etc. And AHF over the last couple of years has been front and center over its voice about what it sees happens in Big Pharma. Tell us just kind of a recap of, help us understand what AHF's point is that they make about what they watch in drug development and organizations like Gilead, etc.
Sure. Yeah. There are people within the organization that can speak far more eloquently about in particular, the legislative side of Big Pharma. But what I'll say from a community engagement perspective is, if we want to end the epidemic, we have to make sure that people are staying in care. We have to make sure that people that are going to come into care have access to affordable medication. And Big Pharma does not allow that to happen. That is a fact that sometimes feels like an opinion that we are sort of throwing out there, and for people to be baited and us go back and forth in this sort of visceral way. But Big Pharma, what it's doing is creating programs like PBM, for example, PBMs that essentially put a lot of more money in between the makers of pharmaceuticals and the person who needs the pharmaceuticals, driving up the costs. PBM is one example of that. Pharmacy benefit manager, for those that don't know what the acronym stands for. And so from my perspective, when you give just one example, and I can give a couple, where pharmaceutical companies tend to be behind some of these programs that make medicine too expensive. HIV meds are just one example of that. We've all heard about the cost of insulin, for example. AHF is one of some organizations doing the work to fight back on Big Pharma. But in my opinion, we've had the largest voice because we need to protect people when we tend to see people through the lens of systems and not the individual experience that's happening when someone may die if they don't have access to the care that we've marked up astronomically. And so we fight back with.
And when you say astronomically, you mean 10,000%.
Oh, yeah. This is not like, $20 or $30. Yeah. That means the cost of medicine in some countries, and I'm not being hyperbolic when I say it, could be $8 or $9. And in this country, it's $300, $400, $500, $600. Yeah. That's horrific. There's no way that people are going to die. Yeah. And we tend to be very lackadaisical about that. And so I think the work that we do at AHF means, how do we fight people and fight systems and organizations that may or may not be bad people, but they're representing a system that makes these things okay, where they are making it commonplace.
They legitimize it.
That's right. Yeah. And so that's the reason why we do this work.
Yeah. And are you in this issue, in the observation and then the fight with Big Pharma, are you optimistic that AHF and other organizations, but AHF is really at the forefront, are you optimistic you can be successful in implementing change?
I think that no doubt there's been some movement towards it. I don't know. As I've gotten older.
Sure, it's still out.
Yeah, I think okay. I'm still a little skeptical.
One last question I want to ask you about HIV and AIDS in general. A lot of people are shocked. I hear so many of my friends say, when we talk about HIV, we generally don't use the word AIDS, but when we talk about HIV, what's the big deal? It's over, it's not happening. And then I remind them that South Florida is the top new infection region in all of America. What do you say when you hear frankly, some ignorance that HIV and AIDS is really all over.
Well, I get that a lot, as you can imagine. Miami-Dade, actually, to your point, is #1 in the country, and Broward County is #2 for new cases of HIV in the country. And I often quote that so they sort of understand. We have hundreds of people coming into one of our healthcare centers every day. And to underscore the legitimacy of what we continue to be up against is not to suggest that we haven't evolved. Of course we have. People are living the same level of care in life as anyone else would without living with HIV. So I don't want to minimize why people think that. What I say to people is the disease has not changed in terms of how you can get HIV. You have sex with someone who is living with HIV and they aren't on PrEP or have not taken the precautions, you can also get HIV. That has not changed from 1980, early 80s to now. That's a reality that you have to sort of ground yourself in. And people don't realize that if you're not in care, you can still die from AIDS. I have a family member that did less than 5 years ago. And I think it's important to note that. And I just want to make one more point that I heard a story about a woman that was living in Palm Beach, married. She was a cisgender woman married to a cisgender man. They married for many years. This was 2017. They thought she was crazy because she thought her husband was poisoning her. She was getting sicker and sicker. She went to many doctors. Again, this is 2017, not 1987. And finally, she was in an ER, dying. And because she was a white, cisgender, straight woman, no one had thought to ask her the question that they ultimately asked her when she had left where she was in another part of Florida to Palm Beach. And an epidemiologist came in and said, "We want to test you for HIV and AIDS." And she had full-blown AIDS.
Wow. In
2017.
Wow.
So I just say that because I think that people minimize how important it is to know your status, get tested with your partner or partners so that you know what you're up against. And there are a lot of medications like PrEP that can prevent you from passing it to somebody else.
I know your
that is the medication.
I know your participation at the UN in 2019. I know AHF is supportive of World Health Organization's goal of 2030 for no new transmissions. When I talked to Dr. Fauci, he was actually relatively negative about us falling behind, especially in the United States, in terms of that goal. Your seat, what do you think in terms of our pursuit of that goal, no new transmissions in 2030?
I think it's a lofty goal. I think we have a lot of work to do if 2030 is realistic. I feel, based on my knowledge and what I see in community, how I see government interact, which is positive in a lot of ways, but how the government interacts in other areas like housing insecurities, food disparities, the uptick of some of these legislations, for example. I think we are pushing people out of care. I think we are continuing to stigmatize a lot of these groups, which to me will only increase the number of cases. I think 2030 is lofty.
Yeah, lofty. All right. Well, as you can see, as we explore with Ebonni the incredibly important role that AHF serves in our community and our healthcare, HIV/AIDS healthcare, which is one of our pillars in our nonprofit mission statement. Along comes this event, the We the People March on July 2nd. We've talked about it a lot. Your mission statement on it says, and challenges everybody, and that's the reason why I repeat it, because it jumped off the page at me. We won't go back. Let's march forward together. The march challenges, it's very clear this is not an LGBT event. LGBT is one of the many communities that have faced and taken it directly on the chin in the last couple of years, especially this year. Explain to everyone what the march is about and what it is designed to do.
So it is, I guess, simply put, it is about an attack on American freedoms. I think to have over 1,000 legislations across the country be sponsored by a legislator, passed and then signed into law, is heartbreaking at best. But it is violent. It has and will continue to kill people. An example of that is when you think about what it means to make an attempt, successful in some ways, at removing gender affirming care. And what the statistic shows is that when you do not honor the science behind gender affirming care, that people will die by suicide as a result of that. We are putting a gun to people's head and forcing their hand. And I think that we the people, that's one example. We the people these body of organizations is saying we are better than this. We can be better than this. And so from our perspective, these hateful laws were about dividing the country. They were about sort of epitomizing what it means to be, in my opinion, white patriarchy. And I think from my perspective,
Christian nationalism.
Christian nationalism, I think, frankly, the list goes on. I think that we can stand Black, white, Jewish, Hispanic, Haitian, Jamaican, young, old, gay, white, straight, queer, trans, can come together because unfortunately we have the unique commonality of being targeted by these legislative acts. And so we the people wanted to bring everyone together to say, we are united. We can be better than this. We can stand for what's right. And frankly, American liberties is what's right. To roll back 70 plus years of success, really, when there's still so much work to do over the course of the last, in my opinion, 10 years, but certainly in the last year, we have more work to do for sure. And I think this only made it seem like now we sort of have to start not even from square one, but before that. And that's frustrating. That's hard to sort of stomach.
I'm curious from your seat, being an architect of this conceptual idea, do you're a cis ally to LGBT, but broadly in terms of what the ambitious goal here is, do you from your seat feel the fear in our community? LGBT, for example, could be anti-Semitic, it could be Black, whatever the marginalization that is going on. From your seat at what you do at AHF, do you feel it yourself?
I do. Yeah, that's a good question. I struggle with the fear that sometimes can be debilitating, frankly. We have to move on with our lives and continue to live and work and play and have fun and enjoy it where we can. But I am a Black woman. I am raising a Black boy. I'm married to a Black man. My very existence is an act of rebellion in a way that sometimes is exhausting. When I had our son, I am and still continue to be acutely aware that Black women have almost triple the chance of dying during childbirth as my white counterparts. That sort of racial inequity that's sort of said in this very pretty academic way. But the fact about it is that the system of oppression allows for us to remove diversity, equity, and inclusion, for example, from government agencies, from schools, the book banning as another example, where we can't even educate our children and adults about a lived experience they may never have, they won't have in some cases. And so it removes the opportunity to have a conversation about, in one way, the healthcare experiences that so many women are faced with. That's one example. And I can give you many. Someone being afraid of going to the bathroom because they are a trans woman and they may be killed because we've essentially lit a fire under people who, based in their own fear and bigotry and racist systems, they can harm, kill people simply because they are trans is horrible. That's just two examples. We the people is coming together because we know that together, united, we can do so much better than we can in silos. Some of our work needs to be individual. That I get. But in this case, I think that we can come together with the march and say, we can be better than this. What are you willing to do in order to move the ball beyond this very partisan, divisive, ugly fear mongering that is taking place with these legislative acts. That's why we the people came together.
You know, I was, frankly, it's an interesting observation you make. I was disappointed in this legislative session when the debate over black AP course in Florida was debated so heavily, and debate is a Democratic word, and that's so therefore not what happened. And
I was gonna say, I was putting it mildly.
Yes, mildly, exactly. And I thought when DeSantis made his observation on the linkage of the Black History AP course, and that it was based in queer theory, that the connection that he made, there would be an overwhelming response from the Black community, and there would be an overwhelming response from the LGBTQ community, because he made that connection, and both communities would kind of unite together to stand against that. And I didn't see that happen in that way. And that's what you've just talked about. From the standpoint of these different communities that are attacked, women in terms of their decision-making of their own health care, or what's happening to trans, or the anti-Semitic slurs. You know, I just had this conversation with Congresswoman Debbie Wasserman Schultz, and she expresses in the district and in the city that she lives the Semitic rise that has taken place against her and her community. Do you think this challenge of this march will help break through all of these different communities to say we're all in this together because we're all being attacked in very similar ways from the same space that these attacks are being launched from? Do you think we're going to see that, or we're just going to continue to walk through in kind of a haze and a dream?
I do think that there will be a shift. I think there's work to do. I think the coalition partners, ACLU, ADL, Dream Defenders, Florida Rising, et cetera.
Anti-Defamation League.
Yes. We have a lot of incredible partners that will continue the work after the march. I think the march is a first step. But I do believe through the coalition and the respective work that each organization is doing on their own to support these efforts, I think that it is and will continue to ignite something really powerful. When Michael Weinstein came to us with this idea, the team that's been planning internally in part with the coalition, I think some people were sort of skeptical and also tired. Like, hey, we've been at this kind of thing for a long time. I don't have it, you know.
He's beating us down.
Yeah, like this is enough, please God. Right. But I think in the planning of it and just being a part of a bigger thing than myself, which is always the case when you do this kind of work, it's amazing. It's really cool. I mean, it's sad that this is why we have to come together, but I think that it will make a change. To the level of, you know, how I can quantify that, I don't know that I can tell you that or even come close. Yeah. But I do think that there is something really inspiring and igniting, invigorating about seeing these communities, to your point, come together. My Black Christian grandparents going to all of a sudden have a incredible eye-opening experience around gay people living their lives however they need to. I don't know.
Yeah.
But what I do know is that we must continue to plant seeds.
Yeah.
And I think that's what we're doing in order to break through the silos.
I love that observation. And frankly, one of the things that I gravitated toward when I started reading what y'all were leading for July 2nd, I know you remember, but in the first year of Donald Trump being president of the United States, there were all the National Women's Marches. And They kind of died off over the years during his reign as president of the United States. But it didn't intersect with LGBT in the way it should. And we're going through a series in June Pride Month of parades all over the country, and the intersections of the Jewish community or people of color or women, they're really parades and marches of all the same thing,
Sure.
of representing us. And this is the first time I can remember in quite a long time, and maybe never, where I've seen so much intersection of all of these communities coming, saying, if you don't come together, we're probably not going to win this fight. And democracy is at stake. And that sounds like hyperbole, but it really isn't.
No, I don't think you're off.
Yeah. Help us on July 2nd. Walk through the day. What can we expect?
Sure.
What will we see?
Yep. City of Fort Lauderdale has given the green light for us to have this rally and march. The rally, starts in Esplanade Park at 9 o'clock. So we'll have speakers from many different organizations, many demographics and groups, say a few words about why they march. And that's really what we want to underscore. I would love for folks that are watching to go to WTP March on all of our social media platforms to see some of the people that you may see speak during that day.
Lots of celebrities.
Yep. We have a lot of people that have supported us, like Debbie Allen, Dolores Huerta, Bootsy Collins, the president of the National Urban League, Mark Morial, and all of our 50 nonprofit organizations and community groups and for-profit companies as well, to say the least. We'll be at the rally from 9 to 11, and then 11 a.m. around 11:15, we'll march for, it's about less than a mile here in downtown Fort Lauderdale. There'll be food trucks and music, family-friendly event for us to be able to bring people together.
So we're going to have fun while we're saving democracy.
That's right. Listen, if it's not fun, I don't want to play.
Right. Exactly.
That's it.
Exactly. And are you optimistic on the turnout?
I am. Yeah. We've done a lot of work. We've done a lot of work.
Yeah.
And I think there are a lot of people in community that do work just like I do, and you know what it is to put together these sort of events. You just had Stonewall, so you understand.
Yeah.
And I do think we're going to see, I have no doubt we'll see thousands of people.
Yeah, you're going to see thousands of people. There is no doubt of that. I springboard the need for the march in terms of what we're watching. Not only the 1,000 pieces of legislation that have been introduced around the country. I just ask you point blank, we're sitting here in Florida. We went through the drag ban fear at Stonewall and what we've watched there, and trans, and the expansion of Don't Say Gay to the 12th grade, and.
Sure.
It's launched by somebody from the governor's mansion who wants to be president of the United States. Why, from your seat and your legislative experience at AHF, of what you watch, what is it that we're watching? Why is this happening? And help beyond the fear that's experienced in my community, LGBT. Why, from your seat, what does your eye tell you? This is happening because, and the fill in the blank.
I think there are a lot of reasons. I don't know that we have enough time to sort of go into to why. I think there's a history. We live in a country that has a history of, at the very least, sort of forcing people into the box and corner that we think would make everyone, the most people, most comfortable. And so even though you're sort of steering me away from it, I do think that there is a fear with people that understand the perspective of people that put these legislations forward. And while I don't understand their perspective completely, I think change is a scary notion for a lot of people. I think that people have a difficult time understanding that some people are non-binary, for example. They can't get their mind around that people are either man or woman. And that is one example of feeling scared. They feel fearful of what that means. And I don't mean scared in the sort of literal way. I mean, it feels unknown. And what do I do with that unknown? And we haven't taken an opportunity.
Uncomfortable.
That's right. Exactly. Yeah. I think another example with book banning, for example, and this has been written, I think a lot of times non-Black folks don't want to be faced with the reality of what this country has done and in a lot of cases continues to do to Black people. And so having to see that reiterated feels uncomfortable. I think there are a lot of non-Black people that do welcome the conversation, that are curious and want to know more. I think those people are a part of the We the People coalition. But I think that part of what we're seeing is this desire to get back to this very sort of stereotypical idea of what the American family is. And that's what I think we're not saying anything's wrong with that. We're saying that there's such a broader view of what family can be.
You know, it's funny, and this is not my original joke, but I think it's very funny. Andy Griffith and Mayberry RFD never really existed. It's a dramatic vision of America. All of the things that we're watching, that we're facing, the Black community faces, immigrants face, people of color, women, LGBT, religious diversity, trans, etc. Are you hopeful that we're going to see better days?
I don't know that I would be doing my job if there wasn't a level of hope and idealism that lives within me. I have always been a person of hope, not just hope, but doing the work and so that hope turns into the reality of goodness, that people can live with this sort of beautiful, kind, loving experience, whatever that path may be. I think one of the ways to do that is by sometimes fighting for equity. And so I think that's what We the People coalition has established, what we will continue to work towards. I don't know whether it would, what you and I may imagine for all people may happen in my lifetime. I hope so. I work for this now. People often say, well, I'm doing it for our children. Certainly I'm doing it for our children, but I'm also doing it for you and I. I want all people not to live in fear of going into a grocery store because they're going to get killed. That's wild that we live in a time where anyone in our state, for example, can go in with a permitless gun as of next week and be afraid of their life.
Safe space in a school.
That's right. That a second grader can't just go to school. That's a real fear for parents. So I think I am hopeful. And I think coming together, I think we're igniting that a little bit more. I don't know what will happen in my lifetime, but I do feel hopeful, yes.
You know, I don't want to shame any of the listeners in our LGBTQ community that are watching us, and we talk about this at Queer News Tonight frequently. I love your answer of being hopeful, and that is a mission of your seat at AHF. But I remind our listeners, it is one thing to be hopeful, but it requires action to fulfill the hope. And the way you can do that is to participate in this march on July 2nd.
Please.
If you don't take action, you're really doing nothing. And nothing, you already know, is what that's going to get you. More information on this amazing event, July 2nd, go to WTPmarch.org. And of course, learn all about what AHF is doing and their mission in our community, and our local community, and our national community, and the worldwide community at aidshealth.org. Ebonni Chrispin, thank you so much. I wish you all success for the event. It's going to be amazing. And thank you for joining us on Unapologetically Queer.
Thank you so much.